Now, next I welcome Dr. Suma Unnikrishnan. She is Associate Professor at Government Medical College, Mancheri. Over to you, madam.
Good morning, one and all. At the outset, let me thank KSOS and Dr. Rekha for including me in this session. So, diplopia charting is nothing but a recording of the diplopic images in 9 cardinal positions of gaze. It can be done either in a patient's view or examiner's view. In patient's view, the examiner stands behind the patient and plot the chart, project the light to the front wall. In examiner's view, the examiner stand in front of the patient and shine the torch. Both are correct, but you have to mark the chart with the side. For example, in this is a patient view, so the right side will be marked here and the left here. The same chart, if you chart in the examiner's view, the side will be the opposite, the patient's right here and patient's left here. So you have to follow some precautions while charting, and the patient should be asked about the tilting of the images, area of maximum separation using their fingers or red and green pencils. And you have to remember a few points. The diplopia will be more in the field of action of paralyzed muscle, and the image seen by the squinting eye will be the fainter one, and the farthest image is from the affected side, and it can be horizontal, vertical, torsional or combined, and it may be crossed or heteronymous or uncrossed or homonymous. Esotropia always produce uncrossed diplopia and exotropia produce cross diplopia. Now remember, all recti palsy except lateral rectus produce a cross diplopia. Lateral rectus palsy as well as oblique palsy produce uncrossed diplopia. Now we can go by step. First find out in which case there is maximum separation of images. After that, you think of the yoke muscles responsible for that particular gaze as shown in this picture. And now note which is the outermost image, which will be fainter and farthest one, and that is due to from the affected side. Then observe whether it is a crossed image or an uncrossed image. Now let us consider some examples. Here you can see the image separation is maximum in levo version. So which are the yoke muscles for this levo version is left lateral rectus and the right medial rectus. Here which is the farthest image? It is from the left eye, because you are wearing the goggles with red in front of the right eye. So the left image is the corresponding, the green image corresponds to the left eye. So this is the farthest one. So this is the affected eye. So left eye, and this is crossed, this is uncrossed image because red is on the right side. So uncrossed image of the left eye could be due to left esotropia. So this is a left lateral rectus underaction. Okay, so coming to this chart here, this is more separated in the dextro version, but this is a crossed image. So this is green on this side. So which are the yoke muscles? It's the right lateral rectus and the left medial rectus. Okay, so the farthest image is from the left eye. So left eye farthest image, left medial rectus is involved. Okay. Now coming to vertical muscles, it can either the recti or obliques. So if it is uncrossed, it is an oblique palsy. If crossed, it is a recti palsy. Now you think of these mnemonics, that is superiors, that superior rectus and superior obliques, the tilt of the image will be to the sound side. Inferiors will tilting to the ipsilateral side. Now consider these examples. So this here, the maximum separation is in levo elevation. So which are the yoke muscles? Left superior rectus and the right inferior oblique. The farthest image is from the left eye. So we consider left superior rectus. You can confirm that the recti produce a crossed image. So see that the green is towards the right side. Note the tilt is to the, this is superior, no? Superior will tilt to the normal side, sound side. So tilting is to the right side. Okay. So this will be a superior rectus underaction. Coming to this example, here the maximum separation is in levodepression. So, which are the muscles? Left inferior rectus and the right superior oblique. Here the farthest image is from the left eye, so left inferior rectus. You can also confirm that recti produce a crossed image, so the green is towards the right side, okay. So, the tilt is towards the ipsilateral side, so the tilt is to the left side. So, this is left inferior rectus under action, okay. Here also, now you consider this one, this here, this is the dextrodepression. So, right inferior rectus and left superior oblique. The left eye is affected and left superior oblique, and here obliques are uncrossed. So, the red is on the right side. So, the superiors will tilt to the sound side. So, this is this tilting to the right side. So, that confirms it is a left superior oblique under action. Now, one more example. Here it is dextro elevation where it is maximum, the separation. So, the left eye is affected. So, the muscles affected may be either right superior rectus or left inferior oblique. See it is a crossed image. So, this is an uncrossed image. This is an uncrossed image. Right, the red is on towards the right side. So, and also here there is a tilt is to the ipsilateral side. So, it is a left inferior oblique under action. So, consider this one, the all cases shows diplopia except dextroversion. Here it is a crossed image. The farthest is from the right eye. So, the right eye crossed image with a normal lateral rectus is right third nerve palsy. Okay. So, remember, third nerve palsy produce a cross diplopia, fourth nerve and sixth nerve palsy produce uncrossed diplopia. You do this when in conditions where in concomitant strabismus, where patient complains of binocular diplopia, not only to confirm diagnosis but also in follow-up of patients to know whether progressing or is it responding to treatment or surgery. But the fallacies are, it is purely subjective and it is unpredictable in uncooperative patients as well as when there is a contracture of the antagonist has developed. So, thank you for your patience here.
Thank you, Dr. Suma, for that illustrative talk.